Hello everybody, Mat Dorrian here, GP at Queen's Road Medical Practice, and this is just a quick video to talk about how you can access medical care during the COVID outbreak, and in particular during this easing of the lockdown. The first thing to say is that some people have been telling us as clinicians that they were concerned about contacting us because they felt we're too busy and they didn't want to trouble us. Please do contact us. We want to hear from all our patients if you feel you need to be reviewed or seen, and we will be happy to deal with your problem. We are dealing with a lot of problems on the phone. Both long-term medical conditions and routine reviews of medication, but also new problems. Often we can deal with them on the telephone, and that's still our default at the moment, is to try and deal with people safely over the phone if at all possible. But there are patients that we of course need to see, and we're happy to do this, and we can safely do this. There is two areas that we're doing this during working hours. One is Queen's Road Medical Practice, and the other one is at the Chest and Heart Clinic at the hospital. The reason for having these two areas is that we're trying to split patients into a hot or a cold environment. And what we mean by this is, in a cold environment, we are seeing patients who, after discussion on the phone, it's felt that need a face-to-face consultation, but have no symptoms at all that could be thought of to be from COVID. So these patients will be directed to Queen's Road Medical Practice, where we will be able to see you with one of our usual GPs. You might not be able to see your normal GP depending on where your GP has been deployed during this, but there is the ability to see people face to face when needed. So if you are directed towards Queen's Road Medical Practice, a couple of changes from what you would normally see. We are asking people when they arrive to call a mobile telephone number and remain in their car until such time as the doctor's ready to see them. Receptionists will then come out and see you in your car and bring you into the surgery, and you can have your consultation. This is to minimise waiting room use, and it's to comply with public health guidance. You can expect the frontline staff at Queen's Road to have masks on, and doctors and nurses to wear gowns, and so plastic aprons and gloves as well. If you have symptoms that could be considered infective symptoms that could represent you having COVID, then you'd be asked to be seen in our hot clinic, which is at the Chest and Heart unit at the PEH. Now that is being run in a very safe way as well, and you will be asked to remain in your car when you arrive, call the reception, and we'll bring you through when your appointment's ready. Again, of course, our staff there are wearing personal protective equipment, and we are swabbing everybody who comes to our hot clinic if they're happy to be swabbed for coronavirus. I'm pleased to say that in the last week, despite seeing quite a few patients at the clinic and swabbing them, we haven't had any positives, which is really good news. But this is a really important part of the emergence from lockdown. We want to continue seeing patients who have infective symptoms, and we'd like to give you that reassurance that we can do a swab and can give you the answer as to whether you have coronavirus or not. And by far the vast majority of people that we see have other symptoms which are related to other infections, or sometimes allergies and things like that. So but we're happy to see patients with infective symptoms, and we're geared up for that and actually actively want to do it so that we can detect any resurgence of coronavirus very early on. Out of hours, if you want to contact the practice, we are running our normal out of hours service, and that is co-located with the emergency department at the hospital. And you will be able to contact that by ringing the normal surgery number. A GP will then speak to you, and again try and deal with most things on the telephone if at all possible. If it's felt that you need a face-to-face consultation, you'll be asked to come up to the emergency department. Just a word about that: there is a slight change from previous. During daylight hours and up till 9 p.m, if you're being asked to come up, you'll have to attend a streaming hut, where there'll be a nurse from the emergency department who will walk through some questions with you and take a temperature, and then direct you to the area that you need to be seen by the out-of-hours doctor if that's the decision. The out-of-hours doctor is working in the cold area of A&E, so the area where there aren't patients with infective symptoms, unless you have infective symptoms, and then you'll be seen in the hot area of the emergency department. The emergency department is open as normal, and please, if you think you have a medical emergency, don't hesitate to contact the ambulance. You can contact our surgery and of course the out of hours doctor if you think you don't need an ambulance to discuss your problems. But the emergency department, like the general practices, is open, has changed its working practice to make sure that we're operating safely, and we'll be really happy to see you with any emergency problem. So hopefully that summarises the ways that you can access medical care. It's really about offering the same service, the same safety of service in a slightly different environment, using telephone consultations more than we have done previously, but in a very safe way, and also offering face-to-face appointments in a secure and safe environment for our patients. Thank you.